try to check their temperature, body temperature, or just cannot go to sleep because they watch too much, focus on too much negative news. How to deal with the kind of situation, Mr. Yang? For this situation, there's some basic principles. First of all, observation, vigilant contact. So they're the basic principles. Observation. You have to observe comprehensively yourself. Listen to mainstream data, information.
Keep contact with your family members and with your friends. To be more specific, first of all, we need to monitor your body temperature. But you need to take certain frequency, for example, find a time to test your body temperature rather than test your body temperature from time to time. And because if you do it from time to time, it's not really the reflection of your body temperature change. Rather, it's your fear or anxiety towards this epidemics. So that is the way to check your body temperature in a fixed time rather than from time to time. Second one, you need to know more knowledge about the prevention and control of the epidemics. For example, you may spend 30 minutes or 60 minutes, an hour, to check more the information or knowledge about the control and prevention of the epidemics rather than read news from time to time and keep your mobile phone always with you and read the WeChat information from time to time. It will increase your pressure. The third one is that don't pay too much attention on information and body temperature check to make your routine life very boring and is controlled by these abnormal behaviors. Try to stick to your normal life. The third one is that you need to master knowledge and information, and you also need to have what I call normal life, proper sleep, proper food. You need to rest for 6 to 9 hours. That is the best hour for you to rest. To sleep too much or too less will do some harm to your health. And also, in your daily life, you try to find something that can relax you or to switch your attention to something different, something beyond this epidemic situation. That is the best way. Number 5, you need to have some training for relaxation. As I mentioned, deep breathe is a very good way for you to feel relaxed, and it's convenient and it's easy to learn. And also, it's really not easy for us to have this long period of time that you stay at home doing nothing that important. So why not using this time to rest, to change the way of thinking, the way of doing things, to try to watch a good sitcom or a opera or film or read a book and doing something different. And lastly, I would like to remind you, if you monitor your temperature from time to time and suddenly you find a high temperature, a fever, you have to see the doctor. You have to go to those hospitals with the clinic fever outpatient clinic, and then to have more medical care. Okay, the third row gentleman. I'm from China Health Magazine, and now we have a delay of the school days. And also, what if the children or students, they have the chaotic daily arrangement, and others, they may be involved into drinking alcohol or play the internet game. So what do we deal with this kind of situation? Okay, it's actually 2 questions. So first, let's talk about the question about students. After the delay of the commencement of the semester, parents have more time with their children. For different age group, we have different countermeasures. For the preschools, And parents' company is very important. Parents and their kids may stay together to try to have some game with a lot of interactions. And if children have some questions about this epidemics, parents need to use this opportunity to educate their children about a healthy life, about the disease, try to comfort psychologically and physically their children. As for those students and parents, I have some concrete suggestions. Number one, both parents and the students need to respect each other, understand each other, and discuss a plan that they can arrange their life properly. Of course, if the students stay at home, they need to have a plan, or they may have a chaotic schedule for their daily life. And secondly, in terms of their routine, they should have the combination of doing household-related chores, and also they need to have a proper plan, even for parents, because they don't need to go to work. It's a great opportunity for them to understand, to know their children well. So they need a plan to plan it properly about their stay-at-home time. And the third one is the study plan for the students. You know, for many schools, they have the classroom in air. They have online-based educational program. So no matter you stay at home or stay in the school, it's the same. You need to be self-disciplined to watch the online courses in a timely manner. The fourth one is about the emotion of the parents, both fathers and mothers. And parents, you know, you need to know your parents. You are not supposed to be anxious, and you need to have a stable situation of the control. And if you have bad emotion or bad temper, it will just influence negatively your children's emotion. As for those kids in their puberty or adulthood, you need to respect their independence. As an individual person, you need to discuss with them. You are not supposed to force them to do something during this special period of time. Secondly, we are also talking about the stress reaction measures among adults. Even we are adults, we sometimes feel anxiety, we feel stressed. We do have some way to release it. For example, if we cannot go out, what about some indoor sports? You can sing a song, or you can do some other things to try to relax yourself or try to comfort yourself to release such pressure. Drinking a lot of alcohol or playing computer game for a long time is not a good way. Or sometimes it may bring you more pressure and bad temper. All in all, I think the best way to address these epidemics is to enrich your life by yourself, to do something with real, genuine interest, do things, and read more, and then you can feel the sense of significance of your life, and then you forget about worrying about these epidemics. Okay, thank you. Okay, let's continue. The third row, that gentleman, please. I'm from China Daily. For some of the patients, they have some mental disorder problems. They need to go to the hospital for the revisit, but it's a special period of time. They will feel so anxious about going to visit their doctors for the regular check. And what about other patients? They suffer from depression. Maybe because of this epidemics, they feel more depressed. So how do we deal with those patients with psychological or psycho problems or mental problems? Okay. So I'd like to give the floor to Mr. Yang for this question. Okay. Yeah. For all the individuals is a challenge, but it's not a problem. First, we need to know for all the chronological disease, they need a very long period of times for the drug taken, and for the dose of those drugs, they are fixed. So I would like to remind those patients with chronological disease, please take drug frequently. Do not reduce the dose of the drug, or you may have the more severe disease of that chronological disease. Secondly, talking about the revisit of the doctors, safety is the fundamental important factors, because there are two things to secure you. The first one, if you go to see a doctor, you need to wear a face mask. That's very, very important. Secondly, you need to wash your hand properly. You don't touch things. If you have to touch things in the hospital, you don't rub your eyes or your nose or touch your mouth, and you try to reduce the contact of your hands with the other organs. And also, secondly, for all the medical institutions, they are managed based on the prevention of the new virus. And if you go to see doctor in Beijing, and before you get into the clinic of the doctors, you need to have 2 body temperature monitoring. Only when you have 2 normal body temperatures can you get into the clinic to see the doctor, which means that we need to screen those suspected patients to give them timely monitoring and diagnostics, and also to guarantee other patients may not be influenced negatively because of this suspected case. So with these measures, it's safe for you to go to the hospital if you have to. And also for the hospitals, they are strengthening the management. For example, for those outpatients, we have the single direction traveling through the hospitals. Temperature check first and register second and see the doctor and take the medicine. So it's a one way rather than both way. And then we can avoid cross-infection during this process. Of course, different hospital may have different measures. If that hospital have some fever clinic, the fever clinic is separated from other clinics. So all these measures are used to safeguard the common patients to ensure they have safe hospital visit. The third one, about those chronological disease patients, if they suffer from anxiety and because of the stress reaction, they may have the severity or increase the severity of their disease. That is something we are also concerned. So, for example, other psychological problem patients, like they suffer from depression or anxiety. Number one, they need to have the self-comfort first. Second, they need to adjust the dose of their drug. Then they can control their emotion properly. Thirdly, and most importantly, they need to seek help from their doctors. Of course, we could have the online diagnosis. We could use those apps from different hospitals for the contact, but still they need to deal with themselves according to the change of their symptoms. They need to manage their disease properly too. Thank you. I'm from Yangtze River Daily and from Beijing Station. I have 2 questions. First one, in Wuhan, they have blocked down the city for dozens of days. In Huanggang, they also have some other lockdown measures. And do you have any suggestions for the people living in Wuhan and Huanggang? The second question is that online or in real contact, for those people which are from the epidemic zones, people may have some strong emotions towards them. How could we comfort people from other areas and their attitudes towards the people who are from Wuhan and Huanggang? Okay, answer your first question. In Wuhan and the surrounding cities, we have very severe traffic management system. That is for the prevention of the epidemics. It's necessary. Now, we all understand that that is a very necessary step for us to control the epidemics. And therefore, we have the following recommendation. For the people who live in those epidemic areas, we need to understand that this is a necessary step and we need to adjust it to this new situation. And also, we have answered many questions raised by our journalists. How could you attack your emotion, your lifestyle towards this new situation? You may try it. So that's the answer for the first question. The second question, in terms of the people's attitudes towards the people who are from the epidemic zone areas, to have this kind of reaction is the natural reaction for the people who are from the epidemic area. But people do not live simply based on our natural reaction. We are reasonable sometimes, right? So sometimes we find reason for a problem. For the epidemics, the reason is that we find a new virus. At first, when we we know nothing about this virus. With the passage of time, with more research, now we have better understanding towards this coronavirus. And in our prevention routine, we have more and more measures for self-protection, and we are armed with the new knowledge to attack this coronavirus. Therefore, we need to be more reasonable. And we also need to see the efforts of the people from our society. And we need to build our confidence to combating this new virus. You know, epidemics is our common enemy. People who are from the epidemic zones, they are our friends, they are our relatives. We do not simply feel hostile to them because they are from the epidemic zones, or we may have more barriers or burden to win this battle. So we need to unite and to understand each other, to support each other, to battle against our common enemy, that is the virus.
So, in the interest of time, so that's the end of the Q&A. So the theme of today's press conference is about these how to address psychological problems resulting from this outbreak. Tomorrow, we'll continue with press conference. We're going to focus on the treatment of these severe cases in Wuhan. So please send your questions to us in advance. Thank you very much for your support. Thank you. Thanks for coming.